hematology and transfusion medicine, clinical examination in blood disease. We check first hand perfusion, telangiectasia, skin crease pallor, koilonychia. Koilonychia in iron deficiency, then pulse rate, mouth, lips for any angular stomatitis, telangiectasia, gum hypertrophy, tongue for color, smoothness, buccal mucosa, petechiae, tonsil, size, conjunctiva, pallor, jaundice, fundi, hyperviscosity, engorged pain, papilloedema, hemorrhage. Fundal hemorrhage in thrombocytopenia. Lymph node, skin, purpura, bruising, purpura petechiae, thrombocytopenia. Abdomen, masses, ascites, hepatomegaly, splenomegaly, inguinal and femoral lymph node. Joint deformity, swelling, restricted movement. Swollen joint in hemophilia. Feet, peripheral circulation, toes, gangrene. Gangrenous toe in thrombocytosis. Urinalysis, blood urobilinogen. General observation to general oil being color, pallor, plethora, breathlessness. Abnormally detected in blood are caused not only by primary disease, blood and lymphoreticular system, but also disease affecting system of the body. Patient hematological abnormality most include general history and examination as well as search for symptom and sign specific primary hematology disorder as an abnormalities of red cell, white cell, platelet, coagulation, lymph nodes and lymphoreticular system. Lymphadenopathy. Lymphadenopathy can cause benign or malignant disease. We can see supraclavicular, axillary, epitrochlear, inguinal, femoral, popliteal causa for lymphadenopathy. And we can see cervical lymphadenopathy, preauricular, parotid, submandibular, submental, anterior cervical, posterior cervical, supraclavicular. Lymphadenopathy history, speed of onset, rate of enlargement, painful or painless, associated symptom, weight loss, night sweat, itch. Examination site, localized or generalized. Size centimeter, character hard, soft, rubbery, fixed, mobile. Search area that not trained for abnormality, dental abscess, other examination, joint, rashes, finger clubbing. Examination of spleen. Move your hand up from the right iliac fossa towards the left upper quadrant of expiration. Keep your hand still and ask the patient take deep breath through mouth to feel spleen is being displayed downward. Place your hand around the patient lower ribs and approach costal margin from the spleen forwards. To help palpate a spleen that is slightly enlarged, roll the patient to right side and examine as before. Characteristics of spleen, not superficial, dull percussion, cannot get examination and between ribs and spleen, move well with respiration. Anemia. Symptoms and signs help to indicate the clinical severity of anemia. A full history and examination need identify underlying cause. Anemia, non-specific symptom, tiredness, lightheadedness, breathlessness, development or thinning of ischemic symptom, angina or claudication. Non-specific sign, mucous membrane pallor, tachypnea, ridge, JPP, jugular venous pressure, tachycardia, flow murmur, ankle edema, postural hypotension. Bleeding can be due to congenital or acquired abnormality in the coagulation system. History and examination help to clarify the severity and underlying cause of bleeding problem. Bleeding history, site of bleeding, duration of bleed, precipitating cause including previous surgery or trauma, family history, drug history, age at presentation, other medication condition, liver disease. Examination, there are two main patterns of bleeding, mucosal bleeding, coagulation factor deficiency. Mucosal bleeding, reduced number of function of platelet, bone marrow failure aspirin, or bone Wilburn factor, bone Wilburn disease. Skin, fatigue, bruises, gum and mucous membrane bleeding, fungal hemorrhage, post-surgical bleed. Coagulation factor deficiency, hemophilia, warfarin anticoagulant, bleeding to joint, hematosis or muscle. Bleeding to soft tissue, retroperitoneal hemorrhage, intracranial hemorrhage, post-surgical bleeding. Disorder of blood cover a wide spectrum of illness ranging from some of the most common disorders affecting human anemia to relatively rare conditions such as leukemia, congenital coagulation disorder. Although latter are uncommon, advances in cellular and molecular biology have had major impact on their diagnosis, treatment, and prognosis. Hematological changes occur as a consequence of disease affecting any system. Important information in diagnosis and monitoring of many conditions. Functional anatomy and physiology, blood flow through the body vascular system consists of red cell, which transport oxygen from the lungs to the tissue, white cell, which are defend against infection, platelet, which interact with blood vessel, and clotting factor to maintain vascular integrity and prevent bleeding, plasma, which contain protein, which with many functions including antibody and coagulation factor. Hematopoiesis. Hematopoiesis describes the formation of blood cell, an active process that must maintain normal numbers of circulating cell and be able to respond repeatedly to increased demand such as bleeding or infection. During development, hematopoiesis occurs in yolk sac, liver, and spleen. Subsequently, in red bone marrow, in the medullary cavity of all bones. In children, red marrow is progressively replaced by fat yellow marrow so that in adult normal hematopoiesis is restricted to the vertebra, pelvis, sternum, ribs, clavicles, skull, upper humeri and proximal femora. However, red marrow can expand in response to increased demands for blood cells. Bone marrow contains a range of immature hematopoietic precursor cells and storage full of mature cells for release at the time of increased demand. Hematopoietic cells interact closely with surrounding connective tissue stroma, made of reticular cells, macrophages, fat cells, blood vessels, nerve fiber. Figure 25.1. Structural organism of normal bone marrow. This is megakaryocyte. neutrophil, erythroid nest, lymphoid, blood cell and progenitor cell, myelocyte, fat cell, vascular sinusoid, and this is bony trabecule. In normal marrow, nest of red cell precursor cluster around a central macrophage, which provides iron. Also, phagocytes nuclei from the red cell prior to their release into circulation. Megakaryocytes are large cells that produce and release platelets into vascular sinuses. White cell precursors are clustered next to the bone trabeculae. Maturing cell migrate into the marrow. Space towards the vascular sinuses. Plasma cells are antibody-secreting mature B cells that are normally present less than 5% of marrow population and are scattered throughout the intravascular space. Stem cell. All blood cells are derived from pluripotent hematopoietic stem cells. These comprise only 0.01% of the total marrow cell, but they can self-renew, make more stem cells, or differentiate to produce hierarchy of lineage committed progenitor cell. The resulting primitive progenitor cell cannot identify morphologically, so they are named according to types of cell or colony they form during cell culture experiment. Colony forming unit granulocyte monocyte is a progenitor cell that produces granulocyte and monocyte lineage CFUE. Cloniformic unit erythroid produce erythroid cell and CPU, IBEG, MEG produce megakaryocyte and ultimate platelets. Growth factor produced in bone marrow, stroma cell, elsewhere control the survival and proliferation differentiation function of the stem cell, their progeny, some such as interleukin 3, stem cell factor, SCF, and granulocyte, macrophage stimulating factor, GM, CSF act on wide number of cell type various stage of differentiation. Others such as erythropoietin, granulocyte colony-forming stimulating factor, and thrombopoietin are lineage-specific. Many of these growth factors are now synthesized by recombinant DNA technology used as treatment. For example, erythropoietin to correct renal anemia, granulocyte CSF colony stimulating forming to sustain neutrophil recovery after chemotherapy. The bone marrow also contains stem cells that can differentiate into non-hematological cells. Mesenchymal stem cell differentiate into skeletal muscle, cartilage, cardiac muscle, and fat cell, where other differentiate into nerve, liver, blood vessel, endothelium. This term stem cell plasticity may have exciting clinical application in future.